Imagine you're sitting in a doctor's office, waiting for the doctor to come in to tell you your diagnosis. He comes in, sits down in front of you, and tells you that you have been diagnosed with cancer. And more importantly, this form of cancer is leiomyosarcoma, which is very rare. Hi, my name is Courtney Straight, and unfortunately for my family, this was our reality when my mother was diagnosed with stage 4 leiomyosarcoma about 3 years ago. What made it even harder for us was that we really didn't even know what cancer was about, and I think that's because we tried to put it out of our mind. We didn't know the symptoms, the treatment options that were available, or anything about cancer, and especially this particular form. So I would like to share with you about the symptoms, what to look for, and the treatment options of leiomyosarcoma. First of all, I want to define leiomyosarcoma for you, since I know it's a pretty big word. Leiomyosarcoma, according to the Cancer Treatment Centers of America, is defined as a rare soft tissue cancer that grows from immature smooth muscle cells. This form of cancer, as it clumps the cells together, often appears in large blood vessels in your stomach, your extremities like your thighs, and other smooth muscle places. According to studies done by Dr. Weaver and Dr. Abram of the Leiomyosarcoma Initiative, these sarcomas are only found in about 10 to 20% of patients with smooth muscle cancer, which makes it very rare. This cancer can also be linked to immune diseases, and this can be why people often get this cancer. Now, I would also like to talk about the different symptoms that can occur with leiomyosarcoma. In the early stages of this cancer, it often depends on where your tumor is forming about what kind of symptoms that you will present. Say for example, if your tumor is in your stomach, you might often experience stomach cramps, fatigue, nauseousness, and vomiting. In the later stages of this cancer, you can experience internal bleeding, vomiting, pain where the tumor is growing, and often very bad stomach pain. This is why it's very important to catch this cancer early, because when it starts to metastasize or grow in your body to different places, it's really often hard to catch the cancer in time to do anything about it. Lastly, I would like to talk to you about the treatment options that are available for leiomyosarcoma. One form of treatment that is currently being tested is a new combination of chemo and drugs. This allows to fight against the chemo and to destroy all the cells that aren't healthy in your body. According to a report from the National Organization of Rare Disorders, they are also working on a new inhibitor that currently is helping with the process of slowing the cell growth, and it is allowing your blood vessels to cut off new circulation to the tumors so that they don't grow and metastasize throughout your body even more, and stopping the cancer. They are also working on a form of surgery that may help, but this is very tricky because with these tumors, often since they grow in your blood vessels, they aren't able to get to the tumor completely without adding further complications because of the bleeding that may occur from the tumor and the vessels in it. In conclusion, sadly to say, my mother actually passed away from this awful disease about 2 years ago. She had a very late stage and form of this cancer, and we weren't able to catch it in time. I believe this is why it's so important to know about leiomyosarcoma and the different things to look for, the symptoms, and the treatment options to know what you can do to prevent this and what you can do to further stop the growth of new cells in your body. I would like to eventually see a cure for leiomyosarcoma and everybody coming together to be informed about this topic and knowing what they are doing. Thank you so much for your time, and I hope you have a great day.